You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Roger Roubal. Dr. Roubal is the founder of Advanced Dentistry in Omaha, Nebraska. We've invited him on the program today to discuss what's new in cosmetic dentistry. Dr. Roubal, welcome to the program.
Thank you, Randy. Glad to be here.
Now, before we get into today's topic, tell me a little bit about your practice. What kind of patients do you typically see?
I see basically three kinds of patients, one of which is snoring and sleep apnea, pain patients, which we treat by neuromuscular dentistry, and by pain I mean headaches and
like
jaw
TMJ
pain.
problems?
TMJ problems, right.
Is that right?
Commonly called TMJ. People will be complaining maybe migraine headaches and just general headaches or ear problems and things like that, and I treat those patients.
That's a big topic. In fact, we've talked a little bit off camera. I'm going to have you back to talk about just that topic.
Absolutely. It's huge. It's almost an epidemic problem.
Is that right? Okay.
Absolutely. Absolutely. And then, of course, I do cosmetic dentistry, and I've been doing that for a long time.
How long?
Probably about 25 to 30 years, actually. So I was one of the very first ones in the Midwest that actually have done cosmetic dentistry, and I've been doing it so long we're actually getting people coming back and upgrading their smiles.
All right.
Our whole idea of cosmetics has changed.
A lot of attention lately on the smile, you know, with shows like Extreme Makeover, things like that. It's become, I guess, mainstream.
Almost. It's become so much more predictable now, and we can treat people today that we didn't think we could treat just even a few years ago. The materials have evolved. We're finding a lot of people who are afraid to come in, so we're doing oral sedation. Becoming very, very popular.
So you do sedation?
I do sedation in my office.
Because people don't like going to the dentist,
Absolutely.
that's for sure.
Absolutely.
Right?
Absolutely. We get all kinds of people. We see people that are secretaries and teachers, and we see people that are CEOs of companies and everything in between.
So all types of people are coming in now?
All types. Young and old.
Okay.
The youngest I've had was maybe about 14. The oldest I've had was, I believe, 93.
So what are the different categories of cosmetic dentistry?
Well, it depends on the dentist you're talking to, I think.
All right.
Some people would say whitening, of course. Whitening of teeth is cosmetic dentistry. Some will say if they put a white filling in a tooth, that's cosmetic dentistry. I personally do a lot of Invisalign, which is a clear tray system, so you don't have any regular braces on. People like that really well. It's very gentle, very easy, works well. And I do a lot of cosmetic bonding, reshaping of teeth. Bonding means you're putting a tooth-colored material on the front teeth typically. And we do a lot of porcelain veneers and crowns depending on what their needs are.
Veneers, and that's what we're going to talk about today.
Veneers, yes.
What is your training, by the way? Any specialized training after dental school?
Absolutely. Cosmetics is something we really have to go out and learn. And when people ask me that question, what should I look for in a cosmetic dentist? Yeah, good question. I say, you know, you have to find somebody that's been actually out there doing it. And been doing it for a long time and isn't married to any one system, has been well trained, asked to see testimonials of patients, asked to see before and after photos. Because I've actually seen in other people's offices where they go out and buy books of finished cases. Is that right? Absolutely. And they can do that? And that's absolutely right. And I've seen websites where, again, they're bought in pictures. How much art and how much science to developing a great smile? Well, I think it's actually a combination of both, because if things are not done technically correct, you're going to have a failure, and so either the nice porcelain veneers will break off or the bond. Yeah. I've had people that have developed headache issues and sore jaws and ear problems and dizziness from veneers that haven't been put on properly. Okay. So I'm real heavy in the science. I'm what's called a neuromuscular dentist. Yeah. And we can maybe talk about that later, but that's the art of getting the bite correct before we do the veneers, and that's very necessary in some cases, not all cases, but in some. Neuromuscular. Yes. Neuromuscular is basically the art and science of determining where one's bite relationship should be. An example would be we see people that have a lot of wear on their teeth, or again, maybe they're chipping off veneers, having a lot of headache issues, and so we use the science of neuromuscular. So you adjust the bite? Sometimes we adjust the bite, and in more severe cases, or fix it. What do you call it? Sometimes I call it change the bite, improve the bite, and we do both. We do modification of the teeth, and sometimes we have to add to them. So with cosmetic dentistry, yes, you have to do both. Absolutely, absolutely. You have to do both to get a very nice result and something that's going to last. Okay, Las Vegas Institute. Yes, yes. You had your training there. Tell us about that place. Well, the Las Vegas Institute, commonly called LVI, is the world's premier institute on how to do cosmetic dentistry. And I've been going there since 1999, and actually I heard the founder, Dr. Dickerson, about 3 years before that, and learned how to do back teeth in a sense to make them pretty and strong, and totally changed my practice. So I've been doing what's called bonding for a long, long time. Matter of fact, I started so long ago that I had to get my materials from out of the country.
Okay.
So I was, again, one of the very first people.
Now, respectfully, I say, you know, you've been learning cosmetic dentistry since '99.
Right. Well,
is there that much to learn, though? I mean, it seems pretty straightforward.
Well, actually, I started back in the '80s, early '80s, so I've been doing this a long, long time.
Is there that much to learn?
Absolutely.
Is that right?
There's a lot to learn. I see people walking in my office virtually every day that are unhappy with someone else's cosmetic dentistry.
Okay.
They come in and they go, and a lot of times they go, there's something, I don't know what it is, but I don't like it. I don't like the result.
Well, anticipating this interview, I feel like I could spot veneers.
Okay.
You know, 20, 30 feet away.
Absolutely.
Big, bulky, fake-looking teeth.
Absolutely. And
are you saying that's in the hands of the dentist?
That is very much, and that's the part of the art.
Okay.
Because normally when I see those patients, the technical aspect has been done very well. They fit well, they aren't having a bunch of gum irritation, but a laboratory designed them. There was no input from the dentist, there was no input from the patient what they desired.
Okay.
And somebody just created some porcelain shells that were put on teeth that are frankly ugly.
Do you see yourself as an artist?
Absolutely.
Is that right?
Absolutely. Absolutely. When it comes to teeth.
All right.
Otherwise, probably not. I probably couldn't hardly draw a stick man, but when it comes to teeth, I think I'm very good at what I do.
Now, you know, you're a dentist.
Absolutely.
Obviously, you're biased. You think they're pretty important.
Absolutely.
How important do you you feel the smile is?
It changes people's lives.
How so?
I've had so many stories. You don't have enough time, but
okay.
Really many years ago, I had actually a woman that's quite senior. Probably 70-ish, 75 years old, and came in, got her mouth just beautiful, and I showed her a mirror, and she started to cry. And I thought, oh my goodness, my dentist brain is going like, oh, she's not happy with the result. And so I asked her, is there anything wrong? And she says, doctor, these are tears of joy.
Is that right?
I've hated my smile my entire life. And at 70-something, she redid her smile, and she loved it.
Is that common, by the way, that people see their smile for the first time and they kind of lose it?
Very much so. We get tears all the time. I've had, where I've done younger people, their parents are crying. I've had people that, one woman just really strikes me. Again, first time I met her, frankly, kind of a mousy, stay-home housewife type person, not dressed very nice, overweight, no makeup, bad hair, bad smile. And after, she was a general practice patient at that time, and probably after knowing her for about 2 years, she said, I want to fix my smile. And this is the 100% truth on this.
All right.
And we gave her a gorgeous smile, and she loved it, and cried and loved it. But when she came back 6 months later for her regular examination, I saw her walking down the hall, and they told me this particular woman was in room 2 or whatever. And I go, no, that's not her. And they go, it's her, you just don't recognize her.
Is that right?
She
so is that when you find people start taking better care of themselves?
She lost probably 50 pounds.
Okay.
The hair was perfect. The makeup was perfect. She told me she had a new job because she didn't work before. She wasn't confident. She didn't want to be in front of people. So she got a new job. And then when we finished the appointment, she says, hey, doc, come with me. Do you have a few minutes? Can you come with me? And I said, absolutely. And she showed me her bright new red Mustang out in front. So it just totally changed your life. And that's what's fun. And I guess what's kind of cool is that, be very frank, I get more hugs from this than probably anything else I do.
You like it?
Oh, I
mean,
love it.
You seem to like it.
Absolutely. It's neat. We change people's lives.
Okay, now you brought some photos.
Yes, I did.
What are we looking at here?
Well, one thing I kind of want to give back to LVI a little bit of a plug.
Okay,
because
that's the place you learned.
That's the place when I really learned cosmetic dentistry. Again, considered the premier teaching institute in the country, probably in the world actually.
All right.
I've been going there since '99. Now that certainly that's not the only place I've gone to learn, but it's where I've gone recently. And I've been proud to be selected as one of their instructors. There's only about 80 of us in the world that are instructors.
Is that right? Okay.
So
you
I
teach other dentists?
Absolutely. So I teach other dentists
cosmetic dentistry.
and also neuromuscular dentistry.
So this neuromuscular dentistry is the bite.
Yes, and what if the bite is not correct, then they can break off all the pretty dentistry that's been done.
All right.
We have people that come in with headaches that they've started with, jaw pain, all kinds of issues that are related to the bite not being correct. So we always look at that. Is that a necessary part of what we do?
So look for a dentist.
Look for a
dentist
that
has specialized training
absolutely.
in neuromuscular dentistry.
I think neuromuscular dentistry is certainly the cutting edge out there. Absolutely. But we have a lot of people that come in that won't smile, and everybody thinks they're upset, standoffish, angry, snobbish, whatever,
yeah.
And they won't smile because they don't like their smile. They're hiding it.